There's an ancient Chinese proverb about the red thread of faith. It says that when a child is born, an invisible red thread connects that child's soul to all those people, present and in the future, who will play a part in that child's life. This thread may stretch or tangle, but it will never break.
Everyone will say is how much Kara gave. And so when she had to start this journey, I think the first thing that we all thought about her family is there was just one wish, and that was that she stay in her home and she die in her home.
All of the siblings and some of the grandchildren took shifts watching Grandma because she needed care daily. It's such an amazing thing that we were all of the siblings and some of the grandchildren were able to come together and to create a care system.
I think it was the dignity they gave my mom. And I do know that there were times that had we not had the quality of care that we did, that we wouldn't have been able to do it and keep her at home. There's just so much emotion when someone's dying, and if you're given the opportunity to deal with it, knowing that they're getting this compassionate, quality care, as a family, you're getting the same thing. And I just can't, again, say how much I encourage people not to be afraid of that.
You have to have, the courage to face what will happen and what the future holds. And I think that, hospice gave us a lot of insight into that and gave us the courage.
I've told this to many people, but she certainly taught us the right way to die. And she knew how she wanted to do it. And she had faith in her children that they could do it for her.
It's just, that's the perfect way. It could not have been more perfect the way that she died. And I wanted my life to be like that. The way that she lived and the way that she died, could not have been more amazing.
Our volunteers at the General Inpatient Program at Providence is probably the most integral and vital part of our program. We really rely upon them a lot. They come in the afternoons usually, and they are able to relieve our families and to be with them. If they have no families, they just spend time with our patients so that they have someone to be by their bedside.
The family is in shock usually when they're informed that their loved one has to go on hospice. And we come in as a team. We're part of a team, and that includes the hospice nurse and the social worker and the home health aide and the chaplain if they so wish one, and a volunteer if they so wish one. And we take a lot of pressure, I think, off the family. And that gives them the opportunity to just devote what time is left to their loved one. And I think that's the value. We give the family and we give the patient time. Maybe not much time, but we give them time.
I think probably the thing that we learn in hospice is the biggest concern that people have is the fact that they're going to have a lot of discomfort, a lot of pain through the end of life. I think we have the abilities and the tools to be able to say, you don't need to, that doesn't need to be a concern for you. And we tell our families that too. One thing we can take off the table is the fact that we can keep your loved one comfortable. Then the rest is really up to them. The program isn't ours, the program is theirs. But we can keep them comfortable so they can do what they need to do.
If we notice any change in pain or anything else, we can notify the nurse immediately, and something can be done quickly.
Yes.
And I think that brings them a lot of comfort, just to know that we're there as a team to take care of them as best we can during their final hours. Families and patients who are, as we've mentioned, at a very vulnerable stage in their lives, and oftentimes a very scary time in their lives. They are just so appreciative that we are there to help them and to be able to support them.
The family that I had in Everett, and there were some daughters and daughters-in-law, and it was a lady who was actively dying. Just felt like I was part of this loving family to this loving send-off, and she sounded like just a fabulous woman who embraced everybody, fed everybody, open door to everybody. And I sort of had this feeling with her as I sat with her that she was kind of passing a baton. It's like I breathed in the very best of her. It was just a wonderful, beautiful experience.
It takes a lot of courage for the teams to come in day after day and do what they do, and do it very well.
With hospice there, that part of their journey has been a better one.
It allows one to live from a heartfelt space.
Yes.
And that's where I aim to live.
About 5 or 6 years ago, I don't remember for sure when, Carol was troubled by her memory. She was volunteering at the Evergreen Hospital. She would tend to forget where she was going and what she was supposed to do when she got there. She got troubled enough with time that she made an appointment with Dr. Bloom, our family doctor, and to get herself tested. Came home one night and said, "Would you go to the doctor with me tomorrow?" I asked why, and she told me, "I think I have some memory problems." So we went to see Dr. Bloom, and he said, "No, you're too young and too healthy to have Alzheimer's disease, but we'll do the testing anyway." And he informed us that, yes, to the best of my ability, I can do. You do have Alzheimer's disease after you've done all the testing, the MRIs and the tests that they run and all that sort of thing. The further it progressed, we began to talk about the what ifs and so on and so forth. And she said, "When you put me in a nursing home or a facility, will you come and visit me?" And I said, "Of course." And she said, "Every day?" And I said, "Of course." Excuse me. And I've managed to keep that commitment since then, and I plan to continue that until it's over with.
The value that Providence Hospice brings to my residents here in this building is just unbelievable. It is such a supportive environment for the residents, but it's also a supportive environment for my staff here as well. And I think that's really, truly the benefit of having hospice here is all the support that we receive and the resident receives.
When we first got here, she would walk around a lot, and having hallucinations, she would pick up what we had termed as dust bunnies off the floor and so forth. And it's pretty flexible. She'd bend over. She actually fell down several times and bloodied her got a black eye and bloodied her nose a few times. And then that finally degenerated to where she was in, you could tell she was in pain because she would just grit her teeth and knead her hands and just wouldn't eat and so forth. And that was when the nurse asked that hospice be brought in. Hospice came in with the pain medication and so on and so forth until we finally got the pain under control to get Carol to calm down where she could eat. She was able to speak for some time after that, and eventually she doesn't speak much anymore. And, although she speaks to me in non-verbal ways, I guess is the best way to put it. I think she still recognizes who I am, even though she hasn't said my name for 2 or 3 months.
From the moment I met Frank and Carol, I just knew that their love story continued. Maybe not as it was when they met, but you can still see that love.
Working together with him and Carol, I mean, hospice focuses on not only the patient but the family members, so being able to get to know him and learn about their past and what they've been through together as a couple and help them with this part of their lives.
We've been privileged to work with Frank and Carol for a long time now, and that is in such a way a blessing because we've gotten to know her at a different level, and then as she progresses with this disease, to be able to kind of soldier on beside Frank.
We know where the journey is going to take us, but while we're walking this journey, we can address the things that come up and make it a little easier, you know. It's kind of like finding a safe harbor.
It's really something because I think any one of us could imagine, it could be us, it really could. And so it's learning for me, and to appreciate the grace of another human being going through this is really tremendous.
The relationship with hospice, from my perspective, has been excellent. I mean, without them I would have perished, I'm sure. It's helped me look at this thing, helped me deal with this whole thing better. I mean, it's much, much more comfortable now than it used to be. I can say that for sure. When you do come in contact with hospice, do what they advise. And be patient. Be patient. I'm still learning. Because they'll tell you as you go through this, you're going to lose your temper sometime, and you'll say, oh no, not me. Oh no, not me. But you will. You will. But you also learn patience and love you didn't think you had. So by utilizing the resources available, mainly staff at whatever facility you go to and or hospice you come in contact with, you'll get through it.
You know, a lot of times we learn from the people that we meet. And I meet Frank. You show a lot of patience and a lot of grace. Because he doesn't know when this is going to end. And I know you struggle with that. But you come every day. And he loves her. And to me, that's a testimony of a wonderful marriage.
As we journey through life, our own red threads weave themselves together with others along the way. Unique with each individual smile of joy or tear of sorrow, our red threads are one of life's mysteries. They provide a blanket of comfort that is made with love, thread by thread. And in doing so, a masterpiece like no other is created, for we are all truly interconnected with our red threads.